Hello everybody here in Facebook. We are here in the virtual room and in the Facebook transmission for the M.P.R International Communication. Okay, we are ready to start a little webinar with our partners in India, with the Spine Action, with the people who organize our courses in India. It's the second course, and I organize this transmission. That's because I want to ask them if they are happy, if the people are happy in India with the courses, because we're starting now the second course, as you see there, as you see in the transmission, we started the second course in India. That's very nice, because we already finished one of them. Saturday is finished, the last examination of the course to have the certificate of the Y University, and then we just start to promote another one in October. All right, we have here all team of Spine Action, and I will give the voice for every one of them, just to say hello to our people who follow us in Facebook. Okay, we start for the lady, for Krishna. How are you, Krishna? How are you there in India? You can say hello to our people in Facebook. Okay.
Hello everyone. I'm doing very well, sir. Thank you so much.
How is how? Tell me your opinion, because you did the course also. You did the formation with all Spine Action. Tell me your experience in the course. Tell all the people who speak English, your opinion. All right.
So, first of all, I would like to thank you because we are very much glad that we are a part of M.P.R family now. And thank you for giving us the opportunity to organize your course online. That is really a great opportunity. And so basically M.P.R is a very holistic approach, and absolutely a very good concept of craniofacial system and postural system and how we balance it. So we got to learn many new things, and it was a phenomenal webinar, I would say. 6 days were amazing, and the way you teach was very innovative. You made very easy to understand to us the concept. So it was in a way a very nicely explained, because it is not only the diagnosis of the root cause, but also we target on the treatment priorities, the specific treatment. And the best part of M.P.R is that it is completely long-term treatment. So the treatments are very much long-lasting. So I would say it is an amazing course and a must-to-do course. My experience was just phenomenal. It was amazing, trust me.
Thank you so much. Thank you so much for you, because it's very important to tell the people the experience as a student, not just an organizer, because you cannot organize a course if you don't understand what are you learning. No? And that's very important. That's why I invite all of you to do the formation, because when you touch with your hands, mainly with your ears, not the hands, because it's online. It's an online course, and you understood it's very easy also to organize future courses, because you learn the protocol, you apply the protocol, because all of you are people who work. There's not only people who organize courses, and that is very important, because you try with your patients the protocol. Okay, let me open now the microphone. Later I coming back to you again. Okay, Robin, how are you, Robin? Tell me tell me the experience, also your experience, because you are organizer of the course but also student. Tell the people here in Facebook your experience, please.
Hello, sir.
Hello. Tell us your experience in the course. All right.
Hello, sir. Are you? It's okay?
Yeah, it's okay. I listen very well. Yes.
Okay, sir. This course is very innovative, very much. we have attended lots of seminar of osteopathy and chiropractic. This gives a very holistic approach. It's not only focused on the particular segment that is misaligned, but it gives a holistic idea how we can manage and stop reoccurrence of any disease. Because in this topic, you have very well explained about the craniofacial system. That is one of the most important part of body. Because if our body is in balance, our craniofacial system is balanced, then all the posture system, all the muscles will be relaxed and will work very well. So I recommend this course to each and everyone, and we are getting very good response from all the students. From all participants are given a very good feedback for this course, and you explain in this very good, in a nice way, and also give the recording of the webinar so that everyone can repeat it again and again and learn the concept. And you also give lots of chance to clarify their doubts. So I think this is one of the best course which we have attended so far.
Okay, thank you.
Thank you very much for giving such a wonderful thoughts to us.
Thank you so much. That is a nice way. I am teaching for 40 years. It's not one day. More than 40 years I am teaching. And when you teach all around the world, after a time, you understand what is the need the people have in each country. And in this course, we are organizing again, because in October we will do another course. I think the magic thing is the direct connection, because we are online, but we can talk like today, because now we are transmitting into the virtual room we normally use for teaching. And the people study like this, talking with me, talking between them, and thinking the depths they are, if you have anything you don't understand. And that, I think, is a very good way to teach. And also, I think, as you said before, when you have the recorder lectures at home, but sometimes we are tired after work. We are tired. We stay there paying attention. Yes, obviously, no. But if you have the recorder of the lecture at home, during the week you can listen and re-listen and study again. And with the PDF, the people have PDF plus recording. This is a goal, because in the follow class, we can say, okay, listen, you have something you don't understand, okay, we clarify, and then we carry on. I think this is a very, very good way to teach. It's my experience for many, many years teaching. And as you see that online is also, if you do the teacher in that way, it's very easy. Because we will do some practical thing with the bed device, after the course, and we will do that online, in direct. You will see with the video camera. I can check. I can show you how to do that, and I can check how the students do that, because today technology help us to do all these things. We have to use technology for these things. Okay, let me ask to Vikas. Hello, Vikas. I know you are driving, because it's a direct, that one. We are in the real life here. In the real life. I will see if you can talk with us. Tell me if you can tell your experience with the people in Facebook. Hello. No, he's not ready still. I don't want he crash for me. Okay. Wait, he stop, and then we have talk again. Okay. All right. Listen, Krishna. What do you think about? Tell the people, because you are physiotherapists, all of you. You are physiotherapists, and all around the world sometimes. The things I want to clarify for the people who follow us in Facebook is this. techniques are well. We are not saying the techniques are not working. All techniques depends the hands of everybody. The techniques work better or bad. But if you have, that is the concept of M.P.R. that I developed 40 years ago. If we have the body, as you learned, yes, in balance, biochemistry, mind, craniofacial system, all these things, any technique is working better and easy. That is important thing. Well and easy, and we do not have relapses because we put not fighting the systems. This is M.P.R. as you understood now. M.P.R. is all clever. It's not something. It's something clever. If you put all the body in balance, you have not aggressions, and if you don't have aggressions, any technique is working better. What do you think about that, Krishna? Tell the people about that, your experience, okay?
Yes. See, after attending the M.P.R. webinar, I would say that M.P.R. should be, it's a necessity for all the fields, like especially dentists, physiotherapists, and osteopath. It is very much important, and everybody should learn this concept because it is very important to know that we don't only target on posture, we need to target on the craniofacial along with the posture. So that balance is very important. And usually any physio or an osteopath or a dentist will be targeting only on one area, the one which they are concerned with. But in M.P.R. we are targeting everything. We do the diagnosis of all the postural planes, we go on for the conversions, we talk about the oculomotor test, we talk about the every level we go. We talk about the full craniofacial system along with the postural system. So that combination is very much helpful. And that is very much needed because that gives a complete root diagnosis and we eventually reach to a proper treatment priority, and which gives a long-lasting result. So if we really want a great long-lasting result, I think M.P.R. is a must for every field, especially one who want to a paramedical and the medical field.
And when I developed the M.P.R., one of the reasons was this, because I understood many years ago, I am 70 years old, and 40 years ago I understood that any one of us, we know how to do our job. I know how to do my job, you know how to do your job. Robin and Vikas, they know very well. You learn that in the university, yes? When the university give you a diploma, they said you are allowed to work. And that's it. But the problem is, many years ago, when I understood, that was, I tell you now, some history of the M.P.R. because you don't know how was started M.P.R. Do you want to know? And we tell the people how it started M.P.R. Do you want? You want to know many years ago how it started? Okay, I will tell you how it started. The first thing that was in 1970. Let me remember that. 1978, 77, 78. I was very young. No, that is history. That I think we have to tell the people the history, to know the present, to walk to the future. Yes, okay. And I will tell you how was born M.P.R. I was very young, a little bit younger than now at that time. And I was finished my specialization in craniofacial orthopedics. Today, you see today, we are giving a direct transmission, and I know how to talk. I am very talking. For me today is easy after that time. But at the beginning, was not like this. I was very young. how I have to talk a conference and find this. And look at that, because you know some things that I will tell you now. Finishing my specialization, imagine a group of podologists invite me to do a conference. And at that moment was not webinar, was not nothing. nothing at all. And he told me, listen, Silverio, why you don't do some conference for us? I think about what I have to tell the podologist. I said, wow, and I mean, these people ask me something, what I have to answer to them, no? Oh, what, that's very complicated. And I said, I will prepare a conference with something of dentistry that they don't understand. Okay? I prepare it because I don't want the people ask me something because, what I have to tell. I prepare something complicated for them, and then I go. I say, listen, I go home. No, okay. And I prepare the lecture in that moment. For podologists, imagine, no? For podologists, I prepare the lecture to them to say, later I tell you where was this conference. And you will be surprised today, the ways of the life, how can they change the life of one person and of a lot of persons, okay? And they said to me, okay, listen, prepare that. And I prepared that, listen, I want to prepare something with X-rays, diagnosis of craniofacial system. And I say, listen, I will finish, and I go home. I say, no. And I prepare to them, listen, this is the position of the jaw after. Okay, I am finished. Listen, we finish the conference. Oh, can I ask you a question? I say, oh my God, what I have to ask me these people to me? No, I say, oh God, help me, please. I said, no. And he said, listen, Silverio, this person you have there, what do you think? What is about the jaw position? I said, listen, I cannot answer. I need an X-ray. No, Silverio. No, I want to escape. No, I said, no, tell me roughly. Okay, listen. For me, it's a position on the back. Okay? All right, listen. Very good. And these crazy people said me, look at Silverio. That was the first time I was open my mind into the posture, 1978. He said, listen, Silverio, bring a piece of paper, no? Black piece of paper. And I was looking at him, he said, I am crazy, but these people is more crazy than me, no? He said, what are you doing, no? I put the black paper with talc, no? White talc. What they are doing, no? And he put this person into the black paper and took the impression with talc. Imagine talc. And I was seeing these people is very crazy. I understood now that situation changed my whole life. My whole life. And they say, look at Silverio. Could you see here the foot? Yes. Look at like this. First finger, no metatarsus, first finger, 5 finger, and calcaneus. You see that? Yes, I am see that. What is that? What that's doing with me? No, I say, what is telling these people? No, he say, you do a triangle, and you know very well Capangi, very officious. Yes, you know very well triangle of Capangi. You know the charge overload. In that moment, for me, Capangi doesn't exist. Okay. And he said, listen, if you put the triangle and you trace the bisectric of the triangle, when they put together, this is the very center of the foot. And I said, thank you for the news. No, I said, but what they have with me that? No, look at people with the jaw on the back, very center of the foot on the back. That was my first introduction in the posture. And that was in Patagonia, Argentina, in the very, very south of the world, very, very south pole, a small group of podologists. And in that moment, I start to understand that maybe something have to do with the job. And when, after time, I meet the Kapanji philosophy, I meet the osteopaths, I meet the physiotherapists, and I say, wow, we have to do some protocol to work together. And that was the beginning of M.P.R. This is a little history of all the history. And in that moment, in 1988, I have to start to study posturology, posture, etc., etc., etc. And in that moment, I started in my mind the thinking to create a protocol to work together. Why? Because when I went to France to study posturology, and I start to see all this connection, as you know, now you are discovering this connection. I discovered that in 1988. And I said to my professor, listen, if you tell me that, I have to say I believe, but I do not know if it's true. But I believe in you, that exists. If you tell me that you cannot do a rehabilitation because craniofacial system is disturbing, and a dentist cannot do a rehabilitation because the posture is not well, I say, listen guys, we have to close our surgeries and we have to go home because I cannot do in 1 minute the rehabilitation of the craniofacial system. How we can work. And in that moment was the first beginning when I start to think how to do the programming of the craniofacial system, and then I added the programming of the body, the food, etc. But that started at that moment. And after that, I developed the bed, that the bed was, at the beginning we do with plastic, the programming. After that, we started to transform the plastic in that device with bed, and then slowly was developed. And then I tell to myself, I have to learn what the osteopath do, what the physio do, what the doctors do. Was a very, very long way to put all together and start the process. That is the history. That's the history. It's amazing history.
You're going to have so many physios, dentists, osteopaths, so many of them.
Oh, I hope the people will join us, and then we'll get, because we have to leave this protocol for the next generation, for the people who come in, okay? And all of you, when you are young people, have to carry on teaching others in the future to leave the M.P.R. live forever. If it's not, when I have to say to my God to say coming back, and I said to see if I do or not a good job, you have to carry on. You have to, every young people in all disciplines have to carry on the teaching. Okay, Robin, what do you think about the history? You see the history of the M.P.R. It's a nice history, yes, it's a very, very nice history. It was magic, no, because imagine, I didn't know nothing about Kapanji, and today I work with Kapanji philosophy, to imagine all the things we put together, okay, yes, okay. Let me see if Vikas is there. Vikas, you have voice or not? Tell me. Are you there? Hello? Hello, Vikas? No, Vikas is not, he cannot talk. Tell me, Robin, what do you think about, after I told you that of the history, what do you want to add for the people who are watching us in Facebook? Yeah?
No, sir, this is really a very important concept, and as in M.P.R concept, no one can do alone. Like
Yes.
a osteopath can do something, physiotherapist can do something, dentist can do something. But in M.P.R, they included all the things. That is a very good for the osteopath, for physiotherapist, for dentist, for medical professionals, even medical doctors. Because if you are not synchronized all the system or craniofacial system, then you will not get the 100% result.
Yes.
Your symptom will be reoccur again and again.
Okay.
Patient will come with the same type of symptoms, like he will come back after 6 months or 1 year. But if we follow the protocol of M.P.R, it gives proper rehabilitation.
Okay.
I think it's an amazing concept, sir.
Okay.
And definitely it will help lots of patients, lots of clinicians in their practice.
Okay.
So it's an amazing concept.
And also something who is real is cheaper. You don't have to invest a lot of money to treat the patient. The only thing your investment is in your brain, to do diagnosis and apply the concepts. You don't need to take a lot of things to work, because sometimes you say this is a good concept, but I cannot apply because I have to invest a lot of money, no? Because that protocol also help a lot of sportive men also, no? Sportive, no? Now
Yeah.
I did a lot of research about that. Sportive men, patients with chronic diseases, but mainly in the young patient, because if we start to apply that concept when the human being is growing, they will not arrive with chronic diseases that you know very well that the people arrive with the chronic diseases because we do not prevent all these things in early age. That is the main concept. That's why I am pushing a lot also in people who are growing, because when the people are growing and we can put together the balance, no, between the biochemistry, the craniofacial system, the food support, all the things, that subject will grow in harmony. And when we'll arrive at mature age, the diseases are less, because you are preventing. That is the main goal that I am teaching all around the world, that the prevention in early age. Obviously, when there is an adult, we cure the adult. But if we prevent in early age, that is better, no? Because you can guide the growth of a child during the steps of growth, and then when will be an adult, the pathologies will be less. This is a main concept also, yeah? Okay?
Yeah.
Okay. Listen, I think we do a lot of explanation for the people who are follow us. I would say to them, please, came to the course, because in India I think a lot of people need of this protocol, and not a lot of people need, because I know very well India is a lot of people who suffer. They suffer in all the world, no? Because some people suffer because you are huge of people. You are very a quantity of people amazing in India, no? And I think that can help a lot all the patients, mainly the patients and the professionists, to work better and easy. That is the concept that I want to leave in this transmission for the people. Thank you so much for your time, because I know you're busy like me. You're busy working, and in India now it's very late. Now in India you have to go to relax, because you are not younger like me. Okay, you are very older people. I saw your faces. I saw your faces. You are tired. You are very tired. Listen, thank you to help us also in India to stimulate the promotion of the M.P.R for all professions. And I think this is the beginning of a long way to do together in the future. Okay, this is the beginning. Start beginning for carry on and carry on.
Long journey.
Okay,
Yes.
thank you so much, because you are young people and I am pushing for the young people, because young people is the only one that can change the future. You understand what I mean? Okay, okay. We have to teach the young people to teach them how to follow the right way for a long way. Okay. Thank you so much for help the M.P.R in India and for help our school. And we will start. Remember, you Saturday you have an examination also. Remember, okay. I am very strong in the examination. Okay, study, please. I see you in the classroom on this Saturday with the final exam to get the university certificate. Okay. Thank you so much. Thank you so much for all of you. Thank you so much for all India people. They're very nice people in India. Okay, very spiritual people in India. I like India, and thank you so much to be with us in this long way of formation. Okay, thank you so much, and I will see you on Saturday. Okay, take care. Take care. I'll see you. Bye bye everybody. Bye 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 bye.
Bye bye. Say ciao.
Ciao ciao.